Welcome to Silicon Slopes Live. We are here with Tad Morley, who's the Executive Director of Outreach and Network Development for University of Utah Health. Tad has led the University of Utah Health's efforts with Project Protect, which is just unbelievable program. It's with the University of Utah Health, Intermountain Healthcare, Latter-day Saint Charities, several Utah nonprofits, donors, and tens of thousands of volunteer sewers across the state came together to sew 5 million medical grade masks for frontline health workers. The project is estimated to be the largest Utah-based volunteer effort since the 2002 Olympic Winter Games. And this Saturday will be a celebration of reaching their goal. Tad, thank you so much for joining us.
Thank you for the invitation, Clint.
It's great to see you, and congratulations on, such a successful project here. And like I just mentioned, Saturday will be a celebration of reaching the goal of sewing frontline health workers. So let's start at the very beginning of this thing. How did this collaboration amongst all the partners I just mentioned come to be?
Well, it's really interesting to see how a small idea can grow into something really big. There was a meeting of cardiologist group or pediatric cardiologists from the University of Utah that met on March 11th, and they were looking at what was going on around the country and saw that in Seattle Children's Hospital, they would run out of personal protective equipment by that Saturday. It was what that was estimated. And one of the members of that group, Dr. Ronald Day, who's a pediatric cardiologist, left that meeting and thought, we have resources in this community that we could use to help address this problem, because we can't buy the equipment. Vendors just didn't have supply. So our traditional supply chains were not accessible. So we needed to be creative. We needed to solve a problem, and we needed to think about the resources available to us to do that. So Ron began sort of asking some questions, simply exploring, and it is remarkable what's come from that. It was because of his questions that several other people got involved, and he reached out to Latter-day Saint Charities and said, this is a problem we're facing. How are you addressing this in other parts of the world, since you have a global institution? What have you learned? And then Dr. Day's department chair, Angelo Girodino, reached out to a member of his team who was a biomedical engineer and said, hey, we've got this shortage of PPE looming. Do you have any ideas? And use your biomedical engineering background, and what are medical grade masks made from? And so he immediately went to work doing research and found out that the material used and reached out to one of his friends, and he sourced the material. And within just a matter of almost 2 weeks, we had material coming from China. We had the patterns developed, and we were beginning to create this enormous team of people to actually produce the masks. So small idea, and turned in very quickly into a very big project.
I love that. So why are these masks so important?
Well, they again, as I said, our supply chain has not been able to produce the needed protective equipment for our frontline caregivers, and they're the ones who are in direct contact with patients who may or may not have COVID-19, and it is essential that we protect them from the exposure that they might get. So these masks, because of the polypropylene mesh from which they're made, are are the best material for that level 3 mask to protect our caregivers against droplet spread of the COVID virus.
What made you believe that it was even possible to sew this many masks?
Well, I think it became our vision as we came together the first day as we kind of brought the collaborative of Latter-day Saint Charities and Intermountain Healthcare and University of Utah and associated nonprofits who are working with us. We started talking about what the need was and how. So what was the problem? What did we need to solve? And how could we possibly achieve this? And when we started talking about using the vehicle of Just Serve, we started breaking down the goal. We said, we really need 5 million masks in order to address the problem. So how do we accomplish that? So we broke it down into small components and started thinking, well, we will need 10,000 volunteer sewers every week for 5 weeks, sewing 100 masks each. And we kind of estimated how much time that would take. And it was bold and audacious, but we said, we think we can pull it off. We have this vehicle through Just Serve where people are able to be mobilized in a volunteer effort like this. And we went for it. And I think it was the courage of all of the people coming together and kind of encouraging one another. So if doubt crept in one area, in one person's mind, another person said, well, we can do this. And, it has been an amazing team of teams where people that don't work together prior to this were thrown together to solve a problem and have worked in an incredibly effective way. Egos have not been in the way. I think that's one of the things that I think has been one of the benefits. People have set aside egos and really just worked together to solve a common problem.
So you mentioned, maybe there were moments of doubt, throughout this process. Did you have any moments of doubt that you could actually pull this off? And if so, what was that like?
So we've actually, this week will be the end of our 5th week, but we did 2 pilot weeks. The first week was we made 30,000 masks with some brave sewers using the kits we put together. We learned a lot from that. The communication during that first week, and then the second week we did 50,000 masks. And to polish this process, we started in a school parking lot. So having the volunteer sewers come and pick up masks, and having people coming from different directions, traffic flowing. We thought we had good signage, we didn't, and people coming everywhere, and then getting feedback from the sewers about issues with the masks. We had a lot of process improvement that needed to be implemented. So there were times when we thought, this is not going to work this way. We need to make some significant changes, but we always found that path forward. And where there might have been doubts, I never felt discouraged. I always felt optimistic that we're going to pull it off and figure this out.
Do you believe something like this could only happen in Utah?
I've thought about that, and I am not so arrogant to think that it could only happen in Utah. I do know that we have a tremendous attitude of volunteerism in the state of Utah, and certainly we have vehicles to mobilize volunteers through Just Serve and other organizations. What we hope will happen as a result of this, the patterns we've developed, the product sourcing that we've done, and our experience is being shared through Latter-day Saint Charities to other places around the globe. And there are actually groups in some countries on the continent of Africa that are hand sewing because they don't have access to sewing machines. So some remarkable efforts are being done on community. So I don't think we are the only ones who can pull something like this off. We've certainly done a remarkable job, and I'm telling you, the heroes in this are the thousands and thousands of volunteer sewers whom we estimate have volunteered more than 600,000 hours of sewing to make these 5 million masks. So it's incredible what has been accomplished.
Well, let's talk about these volunteers. What would you want to say to the volunteers who, as you mentioned, just have donated hundreds of thousands of hours of their time to pull this off?
Well, thank you doesn't seem adequate, but from the bottom of my heart and the heart of the caregivers who are wearing these masks today, thank you. We are so grateful for the selfless service that has been given from these marvelous sewers and volunteers. A few weeks ago, I was working at the Murray DI when a family of 5 children and their parents rode up on bikes, bringing the masks that they had sewn together as a family that week. And they talked about each one of them had a role and a responsibility in producing the face masks. We have had people who have some physical challenges, who haven't sewn for a long time, who brought out their sewing machines and with the help of children have volunteered in this effort. We have people who have sacrificed greatly to do this work. And it is just remarkable what kinds of personal sacrifices people have made to do this. So I believe this has been more than a project about masks. This has been about a community coming together. This has been, I believe, an outlet for people who have been shut in their homes looking for a way to be productive and to do something to give back. And they've done this in a way that's just remarkable. So thank you. Thank you to this wonderful community and to the individuals who've sewn and taken time to do this. It's been remarkable.
So, as I mentioned, this Saturday is going to be a celebration and acknowledgement of the goal that you and all of these volunteers and so many different organizations that I mentioned at the top have achieved here. What do you have planned?
It's going to be, we will have people who are in the leadership of Latter-day Saint Charities and University of Utah Healthcare and Intermountain Healthcare, as well as caregivers who have been wearing these masks, who have asked to come and thank these volunteer sewers. So we will have those people at each of the 5 sites. We also hope to have some representatives of local colleges and universities. They have been in, so this last series, just to kind of create some extra momentum and excitement, the theme has been Sow Your Colors. So people have been able to use the thread that represents the university that they are connected with. And we will have mascots from many of those universities at the Desert Industries sites. And it'll be a celebratory atmosphere, one that we really hope to express our gratitude in sort of a fun and exciting way to the people as they come to deliver their masks. There are about 2,000 cars or volunteers who will go through each of the 5 sites that day. So there's a lot of people coming through, and it's kind of a fun atmosphere to just wave and thanks. And it's not sufficient, but it's the best we can do.
Well, Tad, thank you so much for joining us and talking about Project Protect. It's really amazing what you and the University of Utah Health, Intermountain Healthcare, Latter-day Saint Charities, and of course the volunteers have done to make this possible. I'm sure we'll have you on again at some point, but thanks for giving us an update here and appreciate everything you're doing for Utah.
Thanks, Clint. Appreciate the opportunity.
Have a good one.